Good afternoon. We're going to start the session, which is to lift or not to lift, facelift after threads. Our first speaker will be Dr. Albina. I don't think I need to introduce her. Everybody knows who's Dr. Albina. And she will be talking about navigation fibrosis, challenge, and solution in modern facial rejuvenation.
The mic is not working. Thank you so much for your introduction. So today is a very interesting session, especially for the thread users, and I hope you will receive all the answers dedicated to the threadlifting, fibrosis, combinations with other treatments, especially for the surgical operation. So navigating fibrosis, this is the name and the title of my presentations. All the time, this is historically when the plastic surgeons and dermatologists are struggling and competing with each other of the procedures. For main idea of dermatologists, our specialize is more in non-surgical rejuvenation method with a less invasive, less trauma, less injury during the procedure treatment. And of course, the plastic surgeons, they prefer much more aggressive methods like surgeries, facelifts, even the liposuction as well. Of course, much more long-lasting result, but it needs a lot of time for recovery, and everything, the question is about the fibrosis. Understanding the fibrosis, mostly we need to take into account the fibrosis is the process of the connective tissue proliferation that occurs in response to injury of inflammation, and it's the body's mechanism aimed at the repairing and strengthening damaged areas by isolating them from healthy tissues. So what we have in fibrosis, we have two types of fibrosis, which is a positive one and negative one. Positive one, we mean when it's controlled conditions fibrosis, very thin capsulization, and fibrosis can be beneficial. For instance, like a threadlifting procedures after there's some kind of biostimulators like a hydroxyapatite calcium and polylactic acid, and even after the hyaluronic acid injection. And negative fibrosis, uncontrolled fibrotic tissues, which can lead as a result in the formations of dense scars and tissue hardening, impairing both functions and aesthetics. So how it looks like? So from one side you can see, I will show you. So from one side, you can see. From that side, from the left side, you can see, let's say, negative or bad fibrotic tissues, like you can, for example, notice it during the scars, and yes, excessiveness, uncontrolled collagen deposition, collagen first type and the third type, more dedicated to the scars, keloids, and tissue hardening. And positive, which is good, let's say good fibrotic, which is controlled collagen stimulation, collagen first and the third synthesis, balance extracellular matrix, remodeling. Guys, please. Technical guys, I'm so sorry, I'm not so much young as it seems to be. I can't read screens. They zoom it out and I don't see it, sorry. Please return back my screen. Yes, thank you. Sorry for this pause, but I'm not so much young as it seems to be. So for me, everything should be written, so thanks a lot. So, and good fibrosis, which stimulates the collagen fibers, the first, the third types, which all the time we are talking about during all the conferences. What about the thread lifting? So the threads, yes, it induces control connective tissue growth around the threads, which supports the lifting effects. From one side, we can see the results of absorbable threads, and we can see control connective tissue like a shell, which is around the thread, which creates a controlled fibrotic tissues. What about the race of aesthetic medicine and the no virgin skin concept? There is no virgin skin, so every patient has her own medical history. So growing popularity of non-surgical intervention and growing popularity among the social media and the trends among the women, of course, we practically cannot find such kind of patient without know any type of the previous done any type of the injection. So it starts from the earliest age. Almost all facelift candidates have prior procedures. And let's talk about the fibrosis. Fillers, myths or reality about the fibrosis. The myth, fillers, yes, it's cause for the tissue fibrosis. Of course it leads. But we should take into account if we want to avoid bad fibrosis, granuloma formation, we should follow, first of all, on-label method to avoid big boluses, to avoid, let's say, new generation of the fillers, which is not known in the market with a high G prime. And of course, it's very important to follow on-label methods, which is recommended by the companies. So if you will follow all the recommendation and try to take a low G prime product, try to do in the proper technique, all what we need is a controlled and a good fibrosis. What about energy-based devices as well? If you will burn your patient, of course, if you will do in high-density protocols, yes, you can stimulate uncontrolled fibrotic tissues. And believe me, this is comparable sometimes for the surgical scars, because energy-based devices, from one side, it's super easy to do. Everybody is doing on the social media. But from another side, it makes sense, the parameters of the machine. So take into account all the time when you are looking for the new device. What about lipofilling and liposuction? So yes, as well here we can see somehow formation of the fibrotic tissues. Yes, maybe they can be a little bit aggressive, but if it was done in the proper way, of course, we can as well, let's say, we're not afraid of the fibrosis. Sometimes we can treat them to have a good, best results. Facelift as well, the role in fibrotic tissues is a crucial role. So let's talk about the creation of the fibrosis after the facelift. It's crucial for us. It's very difficult for the dermatologist, because sometimes when the patient's coming for the recovery, we cannot do nothing. Depends of the deftness of the layer, and depends of the recovery time of the patients. Everything makes sense during recovery time after this operation. So if we will look the scale about the creation of fibrosis, of course, the most simplest thing, the most safest thing are skin boosters like mesotherapy, skin booster, and after that we are going to the biostimulator, hyaluronic acid fillers. Depends on the composition, you can see that the scale is changing. More or less, we should take into account and consider about what? Hydroxyapatite calcium fillers. Please don't inject in the bolus if you don't want to have a complications. Try to follow the recommendation. Such easy and simple tools like a cannula, like a retrograde technique, will simplify the methodology and will leave you in the safety zone. Of course, energy-based devices as well, it's also still aggressive methodology, but everything depends on the protocol. And you can see more to the red line, liposuction, lipofilling, facelift, and secondary facelift. Secondary facelift is for us, for the dermatologists, it's crucial because practically we cannot do nothing with such scars. But anyway, we should consider it and all the time ask a medical history of our patients. So, on conclusion, I would like to say there is no more virgin skin, and we need to treat such kind of patients. And the teamwork for optimal outcomes, patient safety and satisfaction. What I mean teamwork, it's in, let's say, dermatologists should work with the plastic surgeon and opposite, and we should help to each other. And adaptation of minimal invasive procedure through integration of the non-surgical methods is vital to delay and complement surgical rejuvenation. Adaptation of surgical intervention by performing a true preoperative examination and diagnosis and by setting realistic expectations for the patient. Thank you so much. I think something happened with my slide.
Thank you very much, Dr. Albina. And now I understand before we always used to complain about the dermatologists when they come to us for a facelift and we have fibrosis. But now I know that, we are even because after the facelift, you have also fibrosis for your patient and you have hard time. So we are equal. Is that okay?
Exactly. So this is the main point. Yes, exactly. This is the main point. So we should work, I think, in synergism because after faceliftings, after rhinoplastics, after mammoplastic, because when you are doing operation, after that you are not, let's say, looking how is going recovery time. Everybody is going to dermatologist. And for us it's very important to understand how scars formatting, what can solution provide for the patient.
The only difference is the age. We give it to you different age. We can have one or two questions from the audience if anybody would like to ask any. Because now we have time. Yeah. Okay. So let's go to the next one. Yes.
So next presenter is Konstantin Sulamanidze. Someone known here.
Thank you, dear colleagues. Welcome again, second day of Kolkhida. Thank you. I hope you are enjoying Kolkhida, and today evening you will enjoy a gala dinner. Dear chairmen, it's a pleasure to be here with you. It's a very interesting theme of surgical interventions after any type of injections or thread lifting or any other. Yesterday on the surgical session, at the end of the surgical day in the Imereti room, we had a very nice round table. And we spoke about facelifts after the thread lifting procedures. And there, all surgeons, they said the same, that today we don't have patients who comes for the facelift for the first time for the aesthetic procedure or the intervention. Most of them, they tried before some other procedures, injections, threads, machines, and so on, and then they are coming to us. So the main idea is that facelift and any surgical intervention is a quite difficult surgery. It's a big intervention, and only professionals should work for the surgery, of course. And if professional works with the patient after some procedures, he will not have problems. So if experienced doctors will work for the surgical intervention, for him will not be additional trouble or problem to deal with such patients. So today we all know that minimal invasive techniques, procedures, you see this room was full these days and tomorrow too. even more people are interested in aesthetic medicine, non-invasive than the surgical one, and statistics also tell us that the average age for the facelift surgeries now is bigger. Now it's 65 plus than before in 2013. It's just a statistics. If you will see ISAP statistics for last 10 years, you will see that. And of course, you know about our history and about our experience in threadlifting. And in our clinic, we did a small statistics also about the amount of the surgical interventions from 2000 and 2008 and now, and we understood that during these years, we added to our services, to our procedures, many new techniques, many new procedures, like new generation of threads, different fillers, different toxins, different machines. But amount of the surgeries, it growing and growing and growing. And also we have a new group of the patients who come for the other minimal invasive techniques. So some surgeons, because they are afraid of the competition, let's say the truth, they are saying on the social media that minimal invasive techniques is dangerous, it's difficult to deal with it, with them during a surgery, and this is just a marketing thing, because in real life, a popular surgeon, a good professional, will always have a patient, virgin face or non-virgin face. In all cases, he will deal with this patient. So what zones we can correct with threadlifting? You know that we can work for brows, for upper zone, middle zone, lower zone, but the main important thing is the indications for the threads. Of course, first of all, we need to understand what kind of patient we have in front of us, what are the indications, and in my practice, I don't know, unfortunately or fortunately, but threadlifting is just maybe 15% to 20% of my practice today. The rest is a surgical practice because in my hands I have more patients just for the surgery. That's why. And when patients come to me, I always start with the maximum that I can do in surgical way. I always say to the patient that gold standard for the facelift, let's say facelift, gold standard is a surgical interventions, and you have different approaches for this, of course. If you are ready for this and I'm explaining how it works, what you need for this, what is the rehabilitation, cost, and risks, and so on, and of course the result, and if the patient has indications like this, of course, I'm saying that you have the only one way, is a surgery. If no, then we are speaking about the other methods. So now the most important questions. What about the threads before and after facelift? Before the facelift, it can be a great solution for many areas to correct, to postpone facelift and other surgeries, but it's very important to understand that threads must be placed in the correct layer. Threads must be placed in subcutaneous tissues, because if you are placing the threads deeper than subcutaneous tissues, if you are placing the threads under the SMAS, or sometimes some doctors, because they don't have practice or because they think that it's right, they place threads too deep. Of course, in case if you do threads wrong way, wrong layer, then maybe in some areas you could have some problems. But when we work in subcutaneous tissues, it will never give any problem, future problem for a surgeon. Here you can see how we are doing a mobilization of the skin in a regular way, and this is the patient after many thread lifts and many other procedures before, and during the mobilization we can see some parts of the non-absorbable suture. It's very easy to remove them if you know how they are placed. Sometimes we don't even need to remove them. Sometimes when we see that they are fixed very well on the SMAS, we can even create a better result for the facelift. We can lift them again, suture again to the SMAS, and they could help us. Of course, how I told, it's very important what product you are using, I mean the threads, and what layer you are using, how you do this, because with any product, with any very safety product, you can create a trouble for the patient or for future procedures. How you know the threads could be great not only for the face tightening and contouring, also for the nose. And in Georgia, rhinoplasty is one of the most popular surgery. And unfortunately, worldwide statistics says us that each 5th rhinoplasty in the world is secondary. That means that we have a lot of patients, a big group of the patients who come after the rhinoplasties to improve some situation, sometimes functional. And you can see this before and after. This is George's patient. You can see here the retraction of the nostril. It's very difficult situation, even for the surgical correction, even for the reconstructive. For this, for example, you need to take a small part of the cartilage. Sometimes you don't have enough cartilage on the septum. You need to take it from the rib. So it's a big surgery, 3-4 hour surgery, and then you should fix it to the nostril. You have a lot of fibrosis tissues here. So even for the surgery is very difficult, but you can see that with threads we can achieve great results. Also, we know about the complications after blepharoplasty, like round eyes and ectropions, and threads could be a great possibility, I'm not saying, I want to explain that for us, for surgeons, it could be a great instrument, like any other instrument that helps us in the work. It could be an instrument for such patients to improve their results. What we can what we can advise such kind of patients, surgical way is a big surgeries and maybe with 0 result, but with threads we can achieve a great result. Sometimes, how I told, threads could be a great instrument for us. For example, this is the patient, young lady, for the not for the rejuvenation, just for the beautification of the upper zone, and in combination, here I'm using surgical and non-surgical methods such as upper blepharoplasty, lipofilling, and brow lift with mobilization, with some mobilization, plus barb suture, plus threads for the elevation of, for the temporal lifting. It works really nicely. And this is some before after. For example, this patient, it's a quite common situation, especially with old techniques of facelift, when we have pixie ear, when we have the scar too far from the tragus, and how we can correct it in surgical way. We should repeat it. We should repeat the incision. But if you know how to work with the threads, for example, with needle method, you can create some loop, and then you can correct this pixie ear. You can even move some tissues. You can see here before. This is after facelift. You can see pixie ear. Then you can see right after, and 6 months after, great results. In combination with liposuction of lower part of the face. This is non-absorbable needle method. 5 years post-op. 5 years. Again, combination surgical and non-surgical. I did for this patient upper lower blepharoplasty, rhinoplasty preservation concept, closed technique, and full face threads. So she was ready for, of course it was a big surgery because of the rhinoplasty and the blepharoplasty, but it was much easier and possible to do in one surgery everything, because I think it's too much if you combine rhinoplasty, blepharoplasty, and facelift in one session. Same patient. Sometimes we have patients that ask to do this only under sedation or local anesthesia. For example, this is my patient 6 months after upper lower blepharoplasty and full face threads with liposuction on the lower zone. She was very happy. One more case before and after, and here was again some combination. You can see some small scar near the earlobe. So what we did here, we did quite aggressive liposuction, then full face thread lifting, and then just a skin correction near the earlobe, no undermining, no smash lifting, nothing. So for the conclusions, I will say the same as Dr. Albina said, no virgin skin concept. I can imagine, I'm saying from the point of view of the surgeon, but I can imagine how dermatologists deal with patients after many interventions, after 2-3 facelifts with a lot of fibrosis tissues and a lot of difficulties you dermatologists has after the surgical interventions. So the best way to work with such kind of patients and to deal with these problems is to be friends. It's a normal situation. In our clinic, we have 8 plastic surgeons and 8 dermatologists, so we are friends, we work together. So it's not right when we are saying that surgery is not good, give complications. It's not right that we are saying that threads or any other minimal invasive techniques are bad thing for the surgery. No, we should find the right indications, we should find the right method and material for our patients to give them this. But if you can't find this for your patients, please send this patient to the other hands. And the other doctor, if patient needs surgical intervention, you should send them to the surgeon. If surgeon will see the patient for the dermatology injections, he should or she should send for the dermatology. This is the way, and this is how we think. Thank you very much.
Thank you very much. We have a few minutes also for a couple of questions if anybody want to ask.
Maybe we will do discussion after.
Okay, so thank you very much. Our next speaker is Dr. George Sakuras, and he will be talking about how minimally invasive treatment can render subsequent facelift more difficult. Thank you.
Thank you very much. So I'm going to talk about a subject that I've published and lectured extensively. But first of all, I would like to thank Dr. Sulaimanidze and Dr. Kadzaya for the invitation. I would like to congratulate them for a wonderful meeting. I would like to thank them for inviting me and my sister Elena Skoura to the meeting and for taking such good care of us. In fact, yesterday we had the opportunity to take a tour in Tbilisi and the suburbs, and we were impressed. We were impressed by the beauty of the city, by the beauty of Georgia, by the history of Georgia, and by its strong religious beliefs. So thank you again. I would also like to say that I totally agree with 2 comments that I heard. First of all, that we're all together, and by Dr. Kadzaya and by Dr. Sulaimanidze, we're all here together, plastic surgeons and dermatologists, we work together. And also, Dr. Sulaimanidze showed some excellent cases of thread lifting results that seemed to me like they were even better than some neck lifts results. But he also said that threads are a very good solution, but you have to know where to place them. So if you go deeper in deeper planes, then you can cause a lot of trouble. So this, as I said, I've published in the PRS Global and the PRS Journal, and also lectured extensively in countries including the Cutting Edge Aesthetic Surgery Symposium in New York, and also in Russia in the past. So when we're talking about minimally invasive treatments, we basically mean 3 categories of treatments: energy-based devices, threads, and injectables. And let's start with energy-based devices. So this patient had done a facelift in another plastic surgeon years before. Some years after that, developed some recurrent laxity in the face and the neck. She then did not want to do another facelift, so she did some treatments with an ultrasound-based device, and she also did some threads. Because of the ultrasound-based device, she developed some cheek fat atrophy. Guess I'm not holding this well. Anyway, never mind. You can see the cheek fat atrophy and with the dimpling in the cheek. So she came to us to correct both the laxity and the dimpling. So I revised her, did a face and neck lift, and also fat grafted her cheeks. And we got to this improvement in the laxity as well as the improvement in the fat atrophy. This was a more severe case of fat atrophy. This patient had done multiple treatments with various energy-based devices. He did not remember the names of them. And you can see severe fat atrophy as well as external and internal scar. Because of the severity of the case, we decided to stage that. At the first stage, I did a facelift to break the scars and also correct the laxity in the face. You see the very wide skin undermining in order to be able to break the scar. And this was our 6 months post-operative result. You can see an improvement in the contour of the face and also in the area of the atrophy in the scar. And then at the second stage, we fat grafted the cheeks from both an intraoral and an external approach in order to get an even better improvement. And this is him at the end of the second stage. So this is where we started. The picture on the left is before the first stage, and the picture on the right is after the second stage. So energy-based devices. These treatments can compromise the microcirculation, and patients who have had them are a little bit like smokers. Interestingly, these patients have often had 4 or 5 such treatments and years of filler injections to their face. So in these cases, we are dissecting through a lot of compromised areas. It is interesting to say that the scar in these cases often extends in the subsmash plane as well, which becomes white and fibrous instead of diaphanous like it is in a virgin patient. They call them collagen builders. They talk about RF or ultrasound building collagen. But we all know that collagen is scar. So basically, we are scarifying the face with these treatments. Threads. This patient had done a facelift in another plastic surgeon 12 years before. Then some years after that, 5 years after that, developed a recurrent laxity. She did not want to have a secondary facelift back then. So she had some permanent threads placed in her face. You can see the scars around the ear from the facelift, along with the temporal hairline distortion. In the occipital area as well, on both sides. And this is an intraoperative picture. You can see the extent of the very narrow skin undermining, which we have outlined, the undermining of the first facelift. It's where the scar extends. And you can also see some threads there. We try to remove what we can. A very extensive skin undermining to be able to remove a lot of all the scars. Threads on both sides. We cut when we cannot pull. We never pull aggressively because we can cause damage to vital structures. And this was the total amount of threads we were able to remove. And this is the 6 months post-op picture. A case of previous thread lifting. This patient was actually from Ukraine, I think. So she had no facelift, but she had done a thread lifting. And the threads were visible through the skin. So this is a picture as we were starting the dissection. And very long threads gradually being removed. They were non-absorbable as well. In the temporal region as well. And threads in the undersurface of the skin flap, where whenever it's possible I remove them, but I have had cases of skin necrosis by trying to remove them, so I'm very conservative with that. And this was the total amount of threads removed. And this is her result, 2 weeks after facelift and her upper blepharoplasty. Another case of thread lifting, she came to me to correct the laxity of the face, but she told me that this dimpling that she had in the cheek was after the thread lifting she had performed. So this was an intraoperative picture where you can see threads under the platysma. Most of the, like Dr. Sulamanidze said, you must not go too deep. Most of the many people placing threads do not have a thorough knowledge of the anatomy of the face. They're not well trained, some of them. So those are often placed deeper as well, capturing multiple anatomical planes and producing symphysis and scars between them. And even if the threads are absorbable, we all know that the scars are not absorbable, they're collagen. So during the operation, we had an abnormal dimpling at the angle of the mouth, shown in the left photograph, because of the previous thread lifting. And that's why we had to do an excessively wide skin undermining to release the tethering. You can see that we undermined up to the angle of the mouth. And this is her 6 months post-operatively. I believe we have a good jawline and a good redistribution of your skin volume. Her malar bones accentuated. But we have a prolonged swelling at the angle of the mouth due to the excessive undermining that we had to do during surgery. You can see at this area. A similar case of thread lifting. We had to do a very wide undermining up to the angle of the mouth bilaterally. And this is her 6 months post-operatively. But you can see there's a prolonged swelling at the angle of the mouth. So threads do not usually limit the ability to finish the flap release. The problem is you cannot always remove them. They can either be stuck to the skin or wrapped around vital structures. So the ones I come upon, I remove if I can. Otherwise, I just work around them. Injectables. This patient had done a facelift 7 years before and a blepharoplasty to another plastic surgeon. Some years after that, had an injectable treatments in the nasolabial folds, which produced granulomas, bad quality injectables. She had some cortisone injections then with no result, and she had also some permanent threads. She came to me to have a facelift. So what I told her is that I'm going to correct the laxity in the face, but I would do nothing to the granulomas. They would still be there. Bad scarring from the previous surgery. This is her 1 year post-op. She has a good result in the facelift, I believe, but the granuloma is still there. I get patients with silicone injected to their lips years before, and when it bothers them along with the facelift, we do a lip reduction. This patient had done a facelift and a blepharoplasty many years before. Then some years after that had injectables. And you can see there was an exaggeration in the injectable therapies performed. So she had this weird looking face. She came to me to have a correction of the laxity of the face and the neck. But I told her we could lift the face and the neck, but I would not get rid of this weird look produced by the injectables. So I did a face and neck lift. And this is her 9 months post-op. You can see the improvement in the laxity of the face. We changed the shape of the face. We corrected the platysma bands. And we removed the fat between and under the bands. But she still looks weird because of the injectable treatments. So we must keep in mind that overfilled faces never go back to normal. Even if you try diluting them, if you try solving them with hyaluronidase, even if you operate on them, they will never go back to normal. They get deformations. This is large volume permanent fillers, silicone. When this lady came to me, she was 70 years old. At the age of 50, she had silicone placed in her face, which literally destroyed her face. On palpation, she felt like a rock. And you can see where the silicone begins. And I told her that there was no way I could dissect her face because it was it felt like a rock. But she told me she was aware of that, and she told me that she was basically concerned about the platysma bands. So I did decide to operate on her. Indeed, I was not able to dissect the face because it was like cutting on stone. But I was able to dissect the neck and provide some improvement to the platysma bands. So large volume injectables. It is nice if the patients admit to it up front, and then you can try to dissolve it like a week or two before the surgery. But often, the patients do not know what they have had injected to their face, and they have had multiple products injected. In Greece, in my country, what I observe is that bad facelifts are facelifts generally that did not last. So less surgery than needed was performed. I rarely see deformations by surgery in my country. In the contrary, butt injectables in my country are deformations. So more injectable was used than needed, and it was wrongfully used. Patients are afraid of being deformed by surgery. They always ask for natural results, but they are generally not afraid of injectables, and they often ask for exaggerations. It is our responsibility as doctors, as plastic surgeons, as dermatologists, to better educate them and to learn how to say no when what they are asking is not indicated. I have in my practice every day a couple of patients I say no to when they ask me injectables in the lips or the malar region. Facelift is safe, it has a predictable result, it has a permanent result, is the natural result, and it's in my opinion the only choice for the correction of the laxity of the face and the neck. And these are my girls back at home. Thank you very much.
Okay, thank you very much. I think we have to move for the last one. So, Nachi Celik is around? Oh, you're around. Okay, perfect. So, threats versus surgery, aesthetic adversaries or strategy allies?
Thank you, dear chairperson, and hello, everybody. Now I will talk about threadlifting and other things, and I will say something in contrast to the other speakers. I have no financial disclosure or conflicts. First of all, we need some answers as a plastic surgeon. I'm a plastic surgeon from Istanbul, Turkey, and I do facelifts, threadlifts, energy-based devices all the time because we need lifting, we need rejuvenation of the skin, and we don't have only one gun in our hand. We have to use all methods. But how long do the facelift results last? Is it permanent, just like Dr. Sakura said? No, I don't think so, because we see secondary facelifts, tertiary facelifts. We see perfect result in the first year, and everything is gone in the third year. But it was supposed to be permanent. No. And is it effective in all parts of the face? And another important question, how can we deal with the patients with recurrent nasolabial folds and marionette lines right after surgery? Again, during the surgery, it seems perfect. In the first 3 months, it looks perfect after deep laying facelifts. And even in the congresses, when I see the results after first year, I see the nasolabial folds and marionette lines of those patients. Do they need another facelift surgery? No. So, first take-home message for the non-surgeons from me, there is no problem to use the threads before the surgery. We can do the facelift surgeries with the threads. It's not complicated. We can use the threads after the surgery. The insufficient surgeries, you can apply the threads without any problem. And we can use the threads during the surgery. And that's for the plastic surgeons. And for this purpose, we can use the threads in the deep layer, in contrary to what Dr. Sakouras and Dr. Konstantin said. We can use the threads in the SMAS layer. But this is for surgeons. It's not for your regular daily thread lifting operations. And I'm going to share the results. I'm going to share the results based on these 125 patients of mine, and which I performed an hybrid, I can say this fancy word, hybrid facelift, combination of surgical and thread lifting at the same time. And look at the complications. Nerve injury, skin necrosis, and hematoma, or delayed skin healing, are the complications that we commonly see after facelift procedures. And thread visibility, foreign body reaction, and infection are the problems of the threads. And we don't see any of these with this method. The best thing with this kind of method is the shortened downtime period for the patients. They don't want to have a big phase after 3 weeks, 4 weeks, and waiting for a beautiful result in 3 months. They want it immediately. And this is a 6-year result of this kind of patient. Most of the time, we don't even need to do deep neck jobs, reducing the submandibular glands, reducing the digastric muscle. Yes, in some patients, we need that. But if we can prevent, if we can correct everything with the thread, that's perfect. And threads, pulls, and vectors. When we do a facelift surgery, the vector of the lift is usually goes to the incision site. So if it's an endoscopic lift, most of the time vector is vertical, and if it's a deep plane, it's more superlateral or lateral. But we may need all of them. So threads are working perfect in those kind of situations because they can prevent a masculinization of a feminine face or feminization of a masculine face with the application of different vectors. These are the myths and misunderstandings in thread use. Threads don't last. We don't need the long-lasting threads. I use silicone threads. They are, but I use polycaprolactone threads as well. I will talk tomorrow. But it's not important. With the facelift, we use PDS sutures for the fixation. And heavy faces, they say that we can't use the threads with the heavy faces. Heavy facelift operations are also very difficult to perform. And everything depends on the vectors and different combinations and the number of the threads at the same time. So the layer logic, this is also very easy actually. There's no role of the threads in the epidermis and dermis, but in the subcutaneous tissue we use the threads, the daily use of threads, polycaprolactone, PDO threads, or PLLA threads. You have to use them in the subcutaneous tissue. And if it's closer to the dermis, you can get more neocollagenase effect. A little bit deep layer of the subcutaneous tissue, which is not available in all patients like the skinny patients, but still we can find, which is just over the SMAS. I use my silicone threads. And what about SMAS? It's debated. I believe it's not debated anymore because when we lift the face with the facelift, we don't lift the skin. We lift the SMAS. So we can lift the SMAS with the threads. But again, this is for surgeons, and I will talk it about later. And what about the neck? Most of the time, we create hammock flaps with the platysma, or we use a lot of sutures inside the neck to create the jawline and cervicomantle angle, and we do deep neck jobs, removing the digastric muscle, removing the submandibular gland. Why? To create a nice shadow in just below the mandible and negative spaces in front of the sternocleidomastoid muscle, and a nice cervicomantle angle, which is lower than 125 degrees in the hyoid. And this is a 23 years old young lady who comes to my clinic for a neck lift procedure. Will you do that for your daughter? I wouldn't do that, because there's an easier way that we can do. Not every patient needs a facelift. Not every patient needs a liposuction. Yes, we can do the same thing with the liposuction, but it will be less effective because we need the threads, like an internal corset. We need the threads to spread the skin over the platysma. And this is what I create here, is the jawline of the patient. This is one thread. And here, the placement of the thread is over the, maybe inside, sometimes over and inside, and the platysma. Platysma is close to skin in that area, but it creates the hammock. And I need another one to create the jawline, cervicomantle angle of this patient at the hyoid level. So with the two threads and some liposuction, we can harvest the fat, we can use that fat for contouring of the face, the cheeks, the mandible, and everything. And also, we can create an inner corset with the threads, and we can get this result. This is immediately after, under local anesthesia. This is 1 year after. Before and after of this patient. And we can use this technique in most of our patients, not of course very heavy necks, but most of our patients during the facelift. What we do, another thing is, during the facelift is the mid-facelift. And here, this is easy for the plastic surgeons. I'm incising at the temple. And I'm dissecting the layers. Just below the superficial temporal fascia and between the deep temporal fascia, there are some layers of fascia, which is called innominate fascia. So in the deeper layers of the innominate fascia, I elevate the SMAS, because when I am under the superficial temporal fascia, it means that I'm under the SMAS. And this is the prezygomatic space, the famous space of the Mendelssohn, prezygomatic space, and over that, it's the SMAS. Now I will place my threads inside that SMAS because I elevated that, and now I want to lift it. So if it was an endoscopic facelift operation, I would use cable sutures or some sutures with difficult maneuvers, or I should go through the skin, go back inside the flap to lift it with the cable sutures. And the cable sutures that we were going to use were, they don't include the cox, and they can create the cheese wire effect, which is something that we don't like. But with the threads, we can do the same thing. Now, I will fix that silicone thread to the deep temporal fascia, like I do when I perform a facelift procedure. When I fix the SMAS to the deep temporal fascia. But of course, this is more versatile, in my hand at least. And this is the result of that patient. And this patient was a perfect patient for a regular facelift. But she has the scars, she showed her scars on the abdomen and breast area. They were all keloid scars, and I also didn't want to go for this kind of procedure. So without any scars, gliding brow lift, some fat injections, fat liposuction, and everything. And this is the result of the patient, and it was very difficult to do even the lip lift for this patient. She thought for 3 weeks before the surgery, and this is the result of the patient. And what about the late results of those patients? This is 2019 and 2025. No skin incision, and the result of the patient. And of course, I don't say I use only threads and some skin excision. No, I used threads, energy-based devices, fat manipulations, fat injections, and everything. And this is 5-year result of the patient. We can do this secondary facelift patients. Secondary facelifts, energy-based device facelifts, they're a little bit difficult. Sometimes it's too much difficult. And this is the result of a secondary facelift patient 3 years after her first facelift. So facelift is not permanent. Maybe, at least in some hands, it's not permanent. So we did this technique, again, hybrid technique. And for heavy face patients, again, this is a patient who has undergone a liposuction under the neck. If you don't use the threads and everything, if you just remove the fat, it doesn't work. And this is 1 year result of this patient. So what is the biomechanical insight, the fundamental of this technique? Now, there's a Hooke's law, which can be applied to facelift surgeries. The F is the force, which is the tensile force that we apply to reposition our flap. It can be our dermal flap, it can be our SMAS flap, it's not important, but it's the force. And the K is the tissue stiffness. And tissue stiffness varies with age, with fibrosis, with previous operations, energy-based devices, even the fillers. So if the K is too high, then, which means the tissue is stiffer, then we have to exert more force on the flap. But we know that from the surgery, the more force, then the more scar, or the fragility of the tissue. We can tear the tissue with a lot of force. So what can we do? We can do more dissection of the flap. But it comes with the complications like nerve injuries, hematomas, inadvertent dissection of the tissue will not result perfect at all times. So this is the Hooke's law. In the facelift, when we do, there's a presentation, there's a schematic presentation of a deep lane facelift. We put our anchoring sutures here, and we are trying to get the effect in the distant part, in the medial part of the face, nasolabial folds and marionette lines. That will be impossible because of the damping of the tissue and mechanical damping of the tissue, and the tissue elasticity goes not perfect like we thought, and it doesn't show the result, the force here. It shows here, but not here. On the other hand, when we put the threads inside the SMAS area in those cases, which means that we are lifting the SMAS, the force is applied to near the target area, not here, up to here, and it reduces the tension. It reduces the tension loss, and it allows precise correction. And on the other hand, independent cogs along the way of the thread also act as multiple fixation points, which reduces the force, which divides the force to each cog, not to the fixation point only. And threads also reinforce the tissue structurally. And that's why when we create the lifting vectors, we can get this kind of results. This is 8 years result of a patient without any deep neck operations and everything. Again, and in this patient and in this patient, we can get a better results with our
1 minute.
surgeries when we combine the threads.
Thank
No
you.
problem.
Perfect. You're on time. Thank you.